MS, PhD, Prasuti Tantra and Stri Rog, Professor and Head, Department of Prasuti Tantra and Stri Rog, NIA Jaipur, who has joined us today in the 220th episode of this national voyage. I, Dr. Garima Singh, on behalf of RAV, welcome you all for today's session. On the onset, we would also like to express our heartfelt gratitude and welcome our mentors who have always been there to guide, motivate, and encourage us for sustenance of this series. Respected Vaidya Shri Devendra Trigunaji, President of GB, RAV. Respected Vaidya Shri Rajesh Koteka Sir, Secretary, Ministry of Ayush. Respected Dr. Vandana Siroha Ma'am, Director of RAV. Let us begin the session by seeking the blessings of Lord Dhanvantari. नमामि धन्वन्तरीयादिदेवं सुरासुरैर्वन्दितपादपद्मं लोकेर्जरारुकभयमृत्युनाशं दातारमीशं विविधौषधीनाम्. Now, I would like to introduce today's expert, Professor Bharati Kumarmangalam ma'am, who is going to throw light on the topic achieving Shreyasipraja through Garbhasanskara. It is my great pleasure to introduce Professor Bharati Kumarmangalam ma'am. Dr. Bharati Kumarmangalam is Professor and Head Department of Prasuti Tantra and Stri Rog at the National Institute of Ayurveda, Jaipur. She leads academic, clinical, and research and administrative functions and serves as Managing Editor of the Journal of Ayurveda. She has published 17 plus research papers and authored a book, Navneetakam. She has delivered six invited guest lectures and served as resource person and chair in national seminars. She guides multiple PG and PhD scholars and is principal investigator in a CCRAS funded clinical trial. She has received national level recognition and actively contributes to government programs for maternal health through Ayurveda. Now, I would like to invite ma'am to proceed with the lecture.
Thank you very much. First of all, I bow at the feet of Lord Dhanvantari for having the opportunity to serve the people through Ayurveda, and the most respected Devendra Triguna sir and Honorable Secretary sir with Padma Shri Rajesh Kotecha sir, and Dr. Vandana Siroha madam, Director RAV, and all the dignitaries. I welcome you all for today's session on the achieving Shreyasipraja through the Garbhasanskara. This is a Ayurvedic protocol. So I'd like to share my presentation. So the most trending current, that is the Garbhasanskara, and different streams of people, they are using these terms, but without without implementing the true sense of Ayurveda. And you can say now the Foxy and all, they have taken up the spiritual aspect of the pregnancy care also. But in Ayurveda, we have the 360-degree coverage of care of the antenatal mother, including the fetus, is there, well described in Samhitas. So even in the principal form, these are described there. But when it is coming to the practice, we have each aspect we have to focus thoroughly, and we have to practice it. When initially when we see, we think that only a few slokas are there, few verses are there. So what is there in Garbhasanskara? Like that we think, but everything is there under that description. So we have to take the spirit of our Samhitas and we have to practice in its full scope this Garbhasanskara. So first of all, I would like to offer greetings from NIA Jaipur. So we know that very well, the sanskara, what sanskara can inculcate something where you want to do samskara on some particular thing. So that is the sanskara. Sama, the word meaning gives the meaning of well planned or well thought of or well executed of. And kara is the action, that is the action. So how well we execute a thought, we execute a action, we execute a function. So that is coming under the sanskara. So in Ayurveda, we know that we do sanskara, and in our culture, in our Vedas, the sanskaras are there, starting from the life till the death. So every crucial turning of life. So one sanskara is advocated by the Samhitas, by the Griha Sutras, and by the commentaries on the Vedas. Even in the Vedas, these sanskaras are there, and we are daily life also we are performing. One among them is the Garbhasanskara, we can say.
Sorry for the interruption, ma'am. I request you to please share your full screen.
Just a moment, Amma. I think a screen I have shared, Amma, full screen. It's not moving. Slide not moving.
No, ma'am.
Just a moment, huh? Is it visible now?
No, ma'am.
Screen visible, huh? Dr. Kiran?
Ma'am, it is not in full screen. Switch to full screen, please.
I have switched, Amma, but somehow it is not visible. Now I am in full screen mode only.
Ma'am, please press F5.
F5. Done? Now? It is visible for me, full screen? No, not it, huh?
No, ma'am.
Excuse me, Bharati ma'am.
Jitika.
Dr. Jitika this
Yes.
side ma'am.
Yes, ma'am.
आ रहा है ना 46% लिखा है जहाँ पे, एक बार उसको पढ़ा के देखिए मैम.
Oh, okay.
Yeah. Otherwise, you can also tap on that TV type of icon.
Done, ma. Is it visible? Full screen?
Ma'am, the icon to the right of a book is there.
I clicked it, ma.
Okay. Kindly zoom in again, ma'am. This says more zoom out.
Okay. Just a moment. Huh?
Press Shift plus F5.
Shift plus F5. Screen, amma. Now it is full screen.
Not yet, ma'am.
Bharti ma'am, kindly share again.
Sharing, amma. Now I.
It's okay,
again.
ma'am. Please take your time. It's okay. Yeah, it is okay.
Is it visible, ma? Full screen?
मैम जहाँ पे 108% लिखा है उसको एक बार थोड़ा सा ड्रैग कीजिए आप लेफ्ट की तरफ, जहाँ पे 108% लिखा है. हाँ जी, थोड़ा कम करके देखिए मैम. माइनस
करना.
यस.
ओके.
या थोड़ा सा और कम करेंगे मैम, थोड़ा सा और कम.
ये बहुत कम हो गया ना.
अभी मैम इसको जहाँ पे मैम बड़ा वाला एक स्लाइड आ रहा है वहां पे एक बार टैप करेंगे तो मुझे लगता है ये साइड वाला अपने आप को हो जाएगा, क्योंकि ना हमने
साइड
नोट्स पे
वाला
टैप कर रखा है आई थिंक। मैम रीडिंग व्यू पे टैप करिएगा, एक बार रीडिंग व्यू पे टैप करिएगा।
हाँ, अभी अभी दिख रहा है मैं फुल स्क्रीन?
हाँ जी मैम अब दिख रहा है, प्लीज कंटिन्यू कर।
ओके
थैंक यू
मैम,
सो मच
थैंक
मैम
यू,
फॉर सपोर्ट, थैंक यू।
thank you मैम. So with this background introduction, Garbhasanskara. So let us see that what is Garbhasanskara. So we know that very well. Sanskara will perform. We want to achieve some qualities in certain things, so we will perform the sanskara. So like the Paradhasanskara we do, and that Ashtadasa, and even the day-to-day life also Sola Sanskara we perform because we want to achieve something or we want to inculcate some qualities. In the similar way, we want some Gunantara Adhana in the Garbha. So we perform the Sanskara to the Garbha. So as such, the term is Garbha Sanskara is nowhere mentioned. Only Shreyasipraja program is mentioned in Samhitas, particularly Charaka Samhita. But we can derive this term because we are performing this kind of Sanskara to the Garbha. Whereas in Samhita, there is mention about the Bija Sanskara. In some other context that Bijabi Sanskaraha, and explanation is also given by Acharya Chakrapani that Abhisanskara Ankura Janina Saktihi. So we can understand that Garbha Sanskara in a practical way we are incorporating both Bija Sanskara as well as the Garbha Sanskara, because we know that we have to perform the Sanskara to the Bijas. Then only we'll achieve good progeny, and we can inculcate qualities in the progeny through the Garbha Sanskara particular. So the entire program comes under the Shreyasipraja program, and we are running the unit also in NIA Shreyasipraja unit, because we are doing both the things under that heading, Shreyasipraja unit. So here, what I wanted to convey here is that Sanskara, Garbha Sanskara or Bija Sanskara, in the conceptual manner, it is there in the Samhita everywhere. So we need not worry about the word that whether we have to use the Garbha Sanskara or not. Because in the Loka, it is very popular. In so many states, it is very well practiced in Maharashtra, in Gujarat, and even I have seen in Rajasthan also. Even modern nursing homes, maternity homes, they have used this word to attract the patients, Garbha Sanskara. Now, even the big hospitals, corporate hospitals, they are using this term, and they are giving the training on the antenatal yoga, antenatal meditation, and listening to the mantra, listening to the raga. So many things they are also adapting. So we need not to bother about whether the term is there or not, but the concepts are there in Samhita. So what is Garbha Sanskara then? Garbha Sanskara is there is a program called the Antenatal Fetal Optimization Program. Very aptly, these terms suits with the Garbha Sanskara. We want to optimize the genes or the genetic memory or the gametes which are taking part in the conception, and we want to optimize the growth of the fetus. So two programs we are dealing under the Shreyasipraja program. So when to perform these Garbha Sanskara? Under two headings we do this. During the Bija Nirmana Kala, we do the Bija Sanskara. That is during the Garbhadana Kala, we do the Bija Sanskara. That is preconceptional care, I can say. And the Garbha Sanskara during the Garbha Kala we perform. That is during the intrauterine life of the fetus. For all through 9 months we do this. So the purpose is during the preconception period, we do the Bija Sanskara in order to get the best gametes which are taking part in the conception, and Garbha Kala Sanskara in order to get a full grown fetus and who can be divided. That is a hypothesis. The fetus can be divided of the fetal origin of adulthood disease. So that is the motto for doing this, the Garbha Sanskara or the Bija Sanskara. What are the components through which we can execute this Garbha Sanskara? So again, our instruments are, we have to, for the purpose of the Bija Sanskara, our instruments are mother, father, and mother's Ahar Rasa specifically. And of course, other elements are attached here. That is the listening to the music or some other mano anukula kathana and lifestyle and yoga. These are the main components through which we can execute these two programs. So during the Bija Nirmana Kala or Garbhadana Kala, the main aim is to obtain the best quality genes, and in order to, these best quality genes will promote the nirmana of the strong dhatu by giving best Panchamahabhuta or in a best combination of Panchamahabhuta and dhatu, and finally the strong body of the fetus can be achieved. So modern system are also believing this concept that care in the initial phases of pregnancy have a large impact on perinatal and subsequent adult health. So now this is the buzzword in the researchers, that fetal origin of adulthood disease. But Ayurveda, it has its roots, and strongly it is said that sanskara should be necessary during the preconception period. That we can understand from the selection of the Kanya. Atulya Gotriyam itself is a big guideline how we can proceed for the preconceptional care. So even the modern and the WHO, they are believing that preconception care makes a great difference when it is performed before entering into the conception. So WHO says that they want to maximize the gains for the maternal and child health through the preconception care. Of course, the components of preconception care are different. WHO preconception care and Ayurvedic preconception care guidelines are different, but the motto is the same for both of them. So the WHO says that preconception care is the provision of biomedical, behavioral, and social health interventions to women and couples before conception occurs. So they have their own, they say that biomedical, behavioral, and social health interventions. Certainly it is missed the spiritual concept here. Medicines, of course, they have their, they say that let the woman be with the optimum level of hemoglobin or the optimum level of the B12, something like that. They have their own this thing guidelines, and they are suggesting behavioral things also and social health also. So the aim of preconception care, as per the modern thing, is that to improve the health status of mother only and baby, and to reduce the behaviors and individual and environmental factors that contribute to poor maternal and child health outcomes. So its ultimate aim is to improve the maternal and child health in both short and long term. But their instruments are very poor. They are choosing the only supplementation of the calcium or the supplementation of the B complex or something like that, and they're asking to perform the mindful meditation, something like that. But we have guidelines to cover all aspects of the preconception as well as the all aspects of care of the fetus. So WHO says that benefits of preconception care is incorporating to prevent control diseases occur at multiple stages of life, strong public health programs that they wanted to chalk out the public health programs to support the preconception care using a life course perspective from infancy through childhood and adolescence to adulthood are needed. Preconception care contributes to these efforts, and even if preconception care aims primarily at improving maternal and child health, it brings health benefits to the adolescents, women and men, irrespective of their plans to become the parents. So they have their own facts that how this preconception helps. They says that 4 out of 10 women report that their pregnancies are unplanned, and they have certain social issues. I'm not going in detail into this. These facts, because they have based on these facts, they are checking out public health policies to support the preconception care. So based on their experience or based on the existing necessities, the question arises why we have to invest in the BHARATHI, or even you extend this question to the Garbhasanskara also. Why we have to invest? So first of all, to reduce the maternal and child mortality, and prevent complications during pregnancy and delivery, prevent stillbirths, preterm birth and low birth weight, and prevent birth defects, prevent neonatal infections. The long list of aims are there in front of the Garbhasanskara. So is it really possible through this preconceptional care or Garbhasanskara? It is really possible, because we can considerably, we can bring down the number of stillbirths, we can bring down the birth defects, we can bring down the neonatal infections by building strong tissues in the body of the baby. So we can prevent the underweight and stunting of the baby, and preventing vertical transmissions. Of course, these are something different. Preventing vertical infections, vertical transmission of HIV and all different aims. They're not exactly the true sense part of the BHARATHI. But definitely we can bring down the lower the risk of the onset of type 2 diabetes, or the child prone to the metabolic disease in his or her lifetime. These all definitely can be achieved through the BHARATHI. So finally they say that preconception care makes a difference definitely in the growth of the baby, and it is a strong base. We can say that to build a strong public of any country. So they have their own public health programs also, but we need to incorporate Garbhasanskara in the mainstream. So then we can also achieve a good public health base. So there are different packages in modern system that I was telling now: screening for anemia, supplementing iron, folic acid. All these only they're addressing, but our this thing is beyond that. So there is a small introduction I would like to give about the Garbhasambhava Samagri. Harmony of the four things are essential in order to achieve the pregnancy. We know very well that Dhruvam Chaturnam Sannidhyat Garbhaha Syad Vidipurvakam. So Rutukshetra Ambu Bija, in a harmony, when they unite in a harmony, certainly Dhruvam Chaturnam, these four, when Sannidhi is happening in a harmony, then Ankura Janana will be the best Ankura we can get. So here means Acharya again thrown explanation on that. Not only simply you think about the Sukra Sonita alone, Garbhajanana ke liye kafi hai. All the four factors are essential in order to get a good progeny. So that is what in the commentary Acharya said, that Acharya Dalhana. And he has given explanation what is Rutu, what is Kshetra. These are the just fundamentals. So this I'm skipping this. So okay. So coming to the Garbhasanskara management at inpatient ward during the preconception stage. So during the preconception, that is we call it as the BHARATHI. So in the preconception, first of all, when couple are approaching us, what we will do, and what Samita says, that first Shodhana should be performed. Then only whatever the medicine, whatever you prescribe for the Bija Shuddhi or any Bija Dushti is there to correct the Bija Dushti, next those things come. First, both partners, they have to undergo all the Panchakarma. But the practically they start bargaining us how long it will take. First they last, then we say that it at least you have to dedicate 6 months time, then you will get the best progeny. Because we wanted both the couple to undergo in a sequence, Vamana followed by Sansarjana, then Virechana Sansarjana, then Vasti, and after that Uttaravasti. So we can club Vasti and Uttaravasti in one cycle, but Vamana Virechana we cannot club, because every cycle, every menstrual cycle, one procedure only we can perform, because in the secretory phase we don't wish to perform. So after the cessation of menstruation, ensuring that 48 hours of completion of the stoppage of menstruation, then we'll start the Deepana Pachana and all. So every one cycle is necessary for each procedure, and it takes 6 months of time. So in our this thing BHARATHI program and in the Shreyasipraja unit, we advocate them the Panchakarma in a sequential manner. They have to undergo complete, not the simple Sadhya Virechana or Sadhya Vamana is not working here. So first we want them to undergo methodically the Deepana Pachana and Snehapana, then Svedana, then Vamana, likewise the Virechana and other karmas. Why this we have to perform? The Shodhana, why we have to perform? Because there are a lot of embryotoxic factors every day we are getting exposed. So similar way, the couple who are planning for the conception, their genes or the gametes are also getting polluted, maybe through the microplastic intake, or maybe the environmental, or maybe the xenoestrogens exposure, particularly the female. Similar, so many genotoxic materials are there in the environment, as well as the food materials, whatever we are taking currently. So we want them to get devoid of these toxic factors from the body. And that happens through the Panchakarma alone, because when we are sending the ghee to the entire body, each cell of the body is receiving this, whatever the Grutapana or the Sneha we are giving. And these Sneha imbibe or attract all those toxins, and these will be reaching back to the Koshta, the major advantage of the human body through which we can flush either upper from the mouth side or from the anus side, that Vamana and Virechana. So in a bulk, these genotoxic materials will be flushed out from the body. So thus, fresh or the optimum, the gamete growth can be assured in both the male and female partners. So after the Shodhana, then Rajaswala will start in the female with the Rajaswala Charya, and then both the couple, they have to undergo conception, this thing, Paracharya. For the female, Ritumati Charya we advise, and Garbhadana Charya for the female we suggest. And these incorporates diet, lifestyle, and of course yoga and pranayama also. Simultaneously they have to perform this. And meanwhile, after the Shuddhi of the body, apart from these Paracharyas, they have to take the medication also to enrich the Bija quality through the Rasayana. And we have our own SOP prepared for the Bharathi and of course Patya Kalpana also we have to suggest them when in our IPD, when patients are there, particularly accordingly diet is also made available. Say suppose if she is in Rajaswala period, so Rajaswala diet will be given to that woman. Likewise, according to the phase of her menstrual cycle, we suggest the diet to take. So Patya Kalpana is also important one. And we have to advise them particularly what patya she has to take. Even it is for the male also, it is advised to the male also what patya he has to take, and what vihara he has to adopt. All those guidelines will give. And apart from these, we do the Nidana Parivarjana also. If they have any Dushti, Bija Dushti, Artava Dushti, or Shukra Dushti, or Kshetra Dushti, are there, then accordingly we'll suggest them to take the medication also. So the Shodhana, the purpose of Shodhana is particularly the Bija Shuddhi. The Bija Shuddhi mainly done through the Virechana. What happens when clinic patients are coming, they'll be very reluctant for the Vamana Karma. So for those people, what we suggest, start with the Virechana Karma first, and then we'll take next to the Vasti, and then medication will give. But it is always ideal to start with the Vamana. But the logic is, if they are not agreeing, then we suggest Virechana, because through the Virechana, Bija Karmukata will be enhanced, as said in Kashyap Samhita. And for the Kshetra Suddhi, what we have to do? We have to do both the Vasti and the Uttara Vasti. Through these two procedures, we can achieve the Kshetra Suddhi. And Koshtra Suddhi is done both through both the ways, Vamana and Virechana, but best Koshtra Suddhi will be achieved through the Virechana. So this consequently will get the best quality Rasadhatu. So Rasadhatu is best, then naturally, automatically, the Artava, Bijarupa Artava Nirmana will also be good. So this is the motto and the importance of the Shodhana Karma or the Pancha Karma in order to achieve the best Bija Nirmana. So these are the references how Virechana is helping. And these are the supports, in fact, for us, how we can clinically, we can tell that these are indicated for the Bija Shuddhi. So simply, हम हवा में कुछ भी नहीं कर रहे. We have all the references in Samhitas, and we are just following these guidelines and executing it at clinical level. So this Samanya Garbhadana Vidhi, if you see, for the purpose of achievement of Shreyasipraja. So entire description we can found here. Na? Sri Pumsayoho Vyapana Suprasonita Garbhashayoho Shreyasin Praja Micheto. तो वो लोग क्या करना है, जो श्रेयसी प्रजा की इच्छा कर रहे हैं, तो वो उनको क्या कर्म करना है, कर्मोपदेक्षामः आचार्य ने सेड कि ये पूरा कर्म आपको फॉलो करना है, देन यू विल गेट दी श्रेयसी प्रजा. सो नीचे जो दिया हुआ श्लोक में डिस्क्रिप्शन पूरा है कि शोधना सबसे पहले करना है ना. स्त्री पुंसौ स्नेह स्वेदाभ्याम उपपाद्य, उसके बाद स्नेह स्वेदन करने के बाद वमन विरेचनाभ्याम संशोध्य, पहले शोधन करना है वमन विरेचन से, देन क्रमेण प्रकृति मापादयेत, देन संशुद्धौ च आस्थापन अनुवासन, शोधन होने के बाद आस्थापन अनुवासन करने का निर्देश है. इसके बाद जो डाइट और ड्रग्स है उसकी बात कही आचार्य ने. मदरोषध संस्कृताभ्याम घृत क्षीराभ्याम पुरुषम स्त्रियाम तो तैलमाशाभ्याम, ये इनकी गाइडलाइंस है. हमें तो क्लिनिकली इसको कैसे एग्जीक्यूट करना है इतना ही हमारा काम है. देन उत्तरवस्ती, इट हैज गॉट सो मेनी डायरेक्शंस हेल्पिंग फॉर दी, मतलब फर्स्ट ऑफ ऑल दोषों से क्लियर कर देंगे क्षेत्र को. देन एनहांस द क्षेत्र कैपेसिटी थ्रू एनहांसिंग द रिसेप्टिविटी ऑफ द endometrium. And innervation also, this Uttaravasti resets the innervation signals to the uterine myometrium, and it will facilitate the functioning of the myometrium, and it enhances the receptiveness of the endometrium. Both are necessary as per the Garbhasambhava Samagri. And Vasti, from outside, Vasti regulates all these mechanisms generally. And but in clinic patients, when they are coming, the couple, when they are approaching us, they come with certain diseases. So in those conditions, we'll insist them. Say, suppose they said that, no, I cannot spare 2 months or 3 months time. So there we'll go for the short paths. So when patient is suffering with particular disease, say like the PCOD is there, or hyperprolactinemia is there, or suffering with some thyroid disorders or autoimmunity of the thyroid. So in those cases, but we insist them to undergo Vamana, thereafter Virechana. Otherwise, if they are very particular about the time, then we'll post them directly to the Virechana. But the sequence can also be altered based on the disease pathology. Say suppose endometriosis or adenomyosis is there. So in those cases, first we can perform the Virechana and then Sansarjana, and then we can go for the Vasti, or the, if necessary, Vamana can also be performed. But when Rajo Dushti is there, so in those cases, definitely Virechana will work better than the Vamana. And of course, Deepana Pachana, these are the general protocols. I think I can skip. Vasti and Vamana Karma, Sansarjana, and all this, I think we can skip. These are the general guidelines. Shodhana Vasti, Sneha Vasti, and giving the Rasayana and Vajikana drugs. For the male and female separate rasayanas and yoga practices, and then we can ask them to adopt the Garbhadana Vidhi. So when coming to the Garbhadana Vidhi, Acharya said that in the Atulya Gotriyam chapter, Acharya Charaka says that the chapter starting with this sloka, you can see this is the sloka number 3, that Atulya Gotrasya Prajakshayante Raho Visrishtam Vidhini Krutasya. ये मतलब उन्होंने सीधा बोल दिया कि आप जब कंसेप्शन के लिए प्लान कर रहे हैं, देन रहो विसृष्टम, गो अवे और समवेयर नॉट नियर टू दैट, नॉट इन द फैमिली, नॉट इन द हाउस, गो टू द सम रिसॉर्ट्स और सम द प्लेस वेयर विसृष्ट place is available to you. So this is also, Acharya said that very clearly, that when the women, when the couple are planning for the conception, so they must stay away because of the shy nature, or some there may be mishappenings will be there during the conception. So to avoid that, Acharya said that Raho Visrishtam, for the purpose of the Maidhuna. And of course, we give the lifestyle modifications also, and we ask them to follow the acharana. This is also very crucial that from the negative things, the people can keep themselves away from the negative things. So, so we ask them to follow or implement the Sadvruta Acharana. And this is also helping us to achieve the good, the nirmana of the bija. And yoga, meditation are also part of the good bija nirmana preparations. And we ask them to undergo this. And apart from, means after the Shodhana and after the all this following the Paricharyas and after the Sadvruta Acharana and after taking the drugs, but still there are two things left to perform. That is listening to the mantra and listening to the Mano Anukula Katana or listening to the music. So there are evidences that listening to the mantra can bring down the high-risk pregnancy. There are studies there establishing that the importance of the. So based on those evidences that we have our own the SOP, the best thing what we have observed in the our Garbhasanskara unit is implementation of Om is very easy and it is very essential also. Listening to the or chanting of the Om and listening to the Om. These two things very common, and other religion people also, they don't have any objection because we don't have experience of other religion verses. So we ask them to listen to the Om chanting, and at least if they are unable to perform, it is very easy, the syllable they can chant it. And very less resistance we feel even for chanting of the Om, and then chanting of the Garbharaksha mantra. We ask them in the first trimester. This is the first trimester prescription: chanting of Om followed by chanting of the Garbharaksha mantra, and then listening to the flute instrumental. The composed of, there are some particular ragas. We suggest them to listen that, and we will give the link also which are available. And second trimester also it will be continued, but the mantra, just alteration is there in the mantra, that listening to the Medha Suktam, because we want to inculcate Medhas, enhancing the qualities in the baby. So Medha Suktam, and then Purusha Suktam. After that, we ask them to listen to the Purusha Sukta. And second trimester and third trimester, because Indriyas are getting more prominent, so listening to the music for more time will allow. And we have our own recorded voice to listen to Mano Anukula Katana. So in association with All India Radio, we have got one of our scholar written that script and teacher, and we have got it recorded, and that we ask them to listen to that. Very soothing counseling type of voice will come in a pleasant atmosphere, and they will listen to this voice. And some creative works also we'll ask them to do, that knitting and filling the puzzles, Sudoku, these kind of things we'll ask them to perform that. And the third trimester, Om chanting, Purusha Suktam listening, and Garbha Raksha mantra also they can listen. And again, that our counseling recorded voice also they will listen. So this is listening to the mantra as well as the Mano Anukula Katana, that counseling voice recorded, that Mano Anukula Katana kind of thing we are executing. And there are evidences that these things will help in the bringing down if any alterations are there on the Doppler markers during the pregnancy. So we can, there are some markers we can identify early that that particular woman will prone to the pregnancy-induced hypertension. So Doppler ultrasound photoplethysmographic assessment usually done, and this is why I have shown here. This is one of the things we can utilize to establish the evidence of the efficacy of the yoga, meditation, and listening to the raga, and performing the puja, listening to the mantra. So this we have done on certain patients. So one example I have shown here. So one woman, she is second gravida, and the previous pregnancy, she developed pregnancy-induced hypertension. Then consequently, that is turned into the preeclampsia. So in this particular pregnancy, she has given us the history. So the proneness is there, and she reported first to our OPD at 7 weeks of gestation. So then she had undergone the entire, and she is very religious. She used to perform twice the puja, and the drugs what we have suggested prophylactically that she was taking, and mantra she was listening to, and om chanting she was performing. So finally, in this case, all things were went very good, and only during the labor, slight elevation of the BP we have observed during the labor only. 130/90 was there. Then we managed through the Jatamamsi and all, and she delivered normally without any this thing complications, and her the before and after treatment PAH markers, we have seen that Condal index and resistance index exhibited higher before the this mantra and raga and all, but after the treatment it has gone down, the pulsatile index and the resistance index, and so this is an evidence that we can understand the mantra and raga, how they help us in order to prevent one of the major causes with the maternal mortality is the preeclampsia and eclampsia. So we are able to, but the thing is, patiently the patient has to follow all these things in routine way. It's simply not like that taking one labetalol goli and everything will be controlled. It's not like that. We are able to prevent that, but this is not only, this entire regimen is not only for the prevention of PAH or the eclampsia. We believe that other remaining high risk factors also can be preventable when we adapt this practices during the antenatal care. And Doppler USG uterine blood flow parameters, we can bank on these parameters to establish evidence of our this thing protocols. And coming to the psychonormalcy, we know that Saumanasyam Garbhadharananam Shreshtam, and even during, that is for the BHARATHI purpose, and during the Garbhasanskara also it is said that Acharya said that Nitya Prasanna Chittata is essential for the woman to maintain during the antenatal care period. And a great emphasis is laid down on the psychonormalcy of the pregnant woman. And even the modern studies also said that when the woman is undergoing high stress and anxiety and mental depression, that will be leading to the either abortion or the intrauterine growth retardation, or the restriction will be there. So the perinatal psychology of mother is also having profound effect on the physical growth, neurological development, and even immunocompetency of the baby. So there are so many studies confirming this. Then comes the fetal origin of adulthood disease. The health of future generations of any country depends, we know that very well, depends on the growth and development of the fetus inside the mother's womb. Means at the beginning, at the seed level, we are able to control these. Means when they will grow up and they will become the people of this country, then the burden, health cost of the governments or the personal burden on health expenditure will be considerably can be bring down. And the prenatal care, including diet and lifestyle of mother, determines the health of the newborn. So we and our understanding, the Samhita's guidelines are in depth in this regard, and the persistent influence of all these the Garbhasanskara practices helps to achieve the good physical growth and neurological development and immunocompetency too of the baby. And through these practices, we can give a good the public strength to the society, to the future generations. So there is a concept called the fetal origin of adulthood disease. By controlling the intrauterine environment, fetal physiology, through the maternal environment and maternal placental physiology, we can achieve this. And in this regard, WHO also says that they are just counseling. They wanted to give the counseling about healthy eating and optimal nutrition, but we have things beyond that, and I explained it before also. And there are some evidences that how PCOS, consequently, the woman after treating PCOS, consequently, if she conceives, then that particular baby will develop the type 2 diabetes in her future. Hypertension may be there, autism and PCOS related disease onsets may be there in that particular baby's future. So there are some evidences how these effects are transgenerational even. Not only that particular baby will suffer, even the next generation also, they may suffer if the mother or father following these kind of things like the smoking. So there are cohort studies examples showing that. Next comes the mechanism how this Garbhasanskara or BHARATHI may be working. The epigenetics, we know that epigenetics is the modality. Not at the genetic level. Genetic level, we are working through the Shodhana purpose that we are getting devoid of the human body of the particular embryotoxic thing. So at genetic level, we are working, but epigenetics also we are working. So what are the epigenetic mechanisms here? So epigenetics have revealed that chemical modifications to histone proteins can be inherited and define how the information in gene expressed can be controlled. Means there is no genetic engineering happening at the level of the gene or the chromosome. Only the expression part we are able to stimulate to go in a positive direction. So the difference you can see here, the genetics and the epigenetics. So in genetics, when the genetic people are working, or the mutations are there in the DNA sequencing and all, so that we are taking care, the phenotypic expression, we are taking care through the Shodhana purpose. But the remaining paricharyas, and the hara and the vihara and the yoga practices, through the epigenetic mechanisms, we are able to work that probably these paricharyas and all, they are on the drugs even, they are promoting the DNA methylation and microRNA interactions and histone modifications to give a positive expression of the genes and allowing the full-fledged functioning in a normal way. Probably, and these are executed through the nutrigenomics, like the Hara, this thing. Nutrigenomics, again, they have divisions, proteomics and metabolomics, something like that. But overall, the epigenetic mechanism, our paricharyas and all, they are working. And there are certain examples that how calorie restriction can cause the adulthood disease. So there is a Netherlands study. It is a long study, this study. And during the famine between the 1944 and 45, due to the German occupation, the calorie availability was very less to the people. And it was restricted below 1,000 calories per day. So the women who conceived during that time, this study compared, and the women who means the children delivered before the famine. So they made the comparison, and they have seen that the individuals exposed to calorie restriction, means those who got delivered during the famine time, they are having higher rate of chronic conditions like the diabetes, cardiovascular disease and obesity in comparison to the siblings, those who have taken birth before the famine, means before the calorie restriction. So this is one example how diet is affecting the onset of the disease in the adulthood. So this is again proving that fetal origin of adulthood disease theory is complete, and the mechanism behind this is methylation of the genes. So again here, the diet is playing a role through the epigenetic mechanisms. So you can see here, the methylation of a gene implicated in insulin metabolism was found in a lower degree due to the famine, the persons who are exposed. And the siblings, those who got delivered during this time, are more prone to it, is observed. And even this effect is transgenerated through other generations. So this is called as the grandma effect also. So these changes may even persist through the generations, affecting the grandchildren of that exposed women. So means whatever the pregnant woman is doing, not only for her children, even for her grandchildren, these effects will be carrying forward. So this way, the Garbhasanskara practices are working there, and the medicinal plants. Of course, I don't want to go into details of these medicinal plants. We know very well all the people that we are working in this field. And music therapy. Coming to the evidences on the music therapy and listening to the mantra, there are evidences, studies carried out. Raga Gopali, Raga Kalyani. There are certain ragas, people are working on that. So how the particular raga is helping to grow normally. There is a emerging evidence that auditory stimulation of in utero human fetus is a predictor for a range of positive outcomes for both mother and the fetus. So a study showed that fetus can hear music in the womb as early as 16 weeks of gestation. So usually the listening to the music we perform in the second trimester of the pregnancy. So here in our Shreyasipraja unit also. These fetuses, they found that the fetuses responded directly to it by opening their mouths and moving their tongue. This is observed on the ultrasonography when they were listening to the fetuses were listening to the music. So fetal sound exposure in the womb, such as talking and heartbeats, may influence their auditory preferences. So that is the reason Uchchair Bhashana and all, we restrict the women, and when the people are quarreling, the women are not allowed, pregnant women, to go and stand there. And getting exposed to when burial ground plays or some Chaitra Gruha and all, there are Garbhopaghata Bhava, detailed description of Garbhopaghata Bhava given in the Samhitas. So probably these are the things they are helping to avoid the negative effects on the baby through the listening to the sounds or the mother's heartbeat increasing. And in particular, antenatal music training is defined as when the pregnant woman uses music, especially certain kinds of positive music, such as classical music or the even nursery rhymes and lullabies. So this study established that the children, those who have born, they are less prone to autism kind of disorders when the woman is performing this kind of listening to the music. So that is one the evidence. In this study, they have adapted some methodology, research design, non-equivalent control group pre-test and post-test experiment they have performed. Baseline survey they have conducted between the 2014 and 16 years. Total of sample size is so good. See, the total of 40,000 children aged around 3 years were enrolled when they entered the 171 kindergartens in Longwa district of the Shenzhen, China. So in this study, both antenatal music training and maternal talk, that is Garbhasamvada, to the fetus were rated on a 4-point Likert scale, and they assessed it. The result is quite interesting that the exposing a fetus to music and maternal speech during pregnancy is associated with a broad reduction in the autistic-like behaviors in congruent with the previous findings of music training for children with the autism spectrum kind of disorders. So an increasing frequency of maternal talk to the fetus was associated with a significantly decreased risk of autistic-like behaviors among children. And I would like to mention that here also, when we are in some cases with when we notice that without any reason fetal movements are so heavy, so in those cases also we ask the mother to sit quietly and talk to her fetus to bring down the fetal movement. Sometimes it happens, but without any reason, everything will be like or everything will be good, but somehow the fetal movements, so heavy movements they feel. So in such cases, we have experimented with the Garbhasamvada. Garbhasamvada is the maternal talk. And the previous days, mother, they used to have time and they used to talk to their baby. And we know the maternal talk also, evidence through the this Abhimanyu, that Samvada with the mother instructing to the Abhimanyu, and he learned how to enter into the Padma Viha. So we know that story. So these are the evidences how the Garbhasamvada helps the fetus So, mother-fetus interactions through the maternal talk and tactual simulations are effective in enhancing the mother-fetus attachment and improving the maternal health relevant coping behaviors during the pregnancy. So, in this study, 52 participants, first pregnancy couples visiting 2 medium-scale obstetrics and gynecological clinics located in the Guangzhou province were selected into the study, and 2 groups, experimental group and the control group, 25 couples and 27 couples sample size. The experimental couples were provided with a some Taxo program for 4 weeks. And this post-treatment maternal fetal attachment, paternal fetal attachment, and motherhood significantly increased in experimental group when compared to the control group. So this is establishing the evidence of the efficacy of the Garbhasanskara evidence in bringing out the good maternal and fetal outcomes. So are these procedures relevant? Definitely relevant. And we have seen through the pandemic also how strong our genes were. And only because of the fear, some people, they have died during the pandemic. Otherwise, we were able to survive through the pandemic times in both the waves. So Masana Masik, starting with the, I can say the BHARATHI practices, Masana Masik Paricharya, and Ahara Vihara, Aushadha, Garbhasanskara, listening to the Raga, all these things will definitely help to build a optimum grown fetus. So thank you for listening to me patiently. Thank you very much for the opportunity also.
Thank you, ma'am. Now I request the participants, if anyone is having any doubts, you may please ask me, ma'am.
Hello.
Yes, sir. Sir, namaste.
Namaste. This is Dr. Krishnaya from Tirupati.
Yes, sir. Namaste. I have seen, sir, your name on the screen.
Okay. First of all, I congratulate you, Dr. Bharati. It's a very good study, and this is the need of our. If we want a real pure generation to come, and the whole world is polluted because of the personalities. So this is a very good subject. But one thing, just I wanted to know. See, until the birth of the baby, the child is a continuation of the past life. That is what explained in Kashyap Samhita.
Yes, sir.
You aware of this? See, the Garbha is having the same memories being continued of the past life until the baby is delivered.
Yes, sir.
There is a reference in Kashyap Samhita.
Yes, sir.
I'll let you know later on. If you want an exact reference, then I can give you. It is there in Kashyap Samhita. And so there are so many diseases which are out of the this human control or the medical system. And it is established that a foreign psychologist, now he has become a philosopher, Gyan. Have you heard it or not? There is a regression therapy. That means by the method of regression, one can go into the past life. The person can be brought into the past life and knowing the cause of the disease. So this may be helpful in your way of study. That is what I wanted. There are a number of references are available, and books are published by Brian Weiss. And there is a society now, the death syndrome research in America. So they are studying about the death, and this Brian Weiss is responsible for regression therapy. Now it is being followed by some of the modern pediatricians to know about the disease, whether really it is related to this life or past life. So this is only out of interest I suggested you. Anyway, congratulations, and I wish you all the best for your further study.
भारती जी नमस्कार, बहुत बहुत बधाई। बहुत सुंदर आपने संस्कारों का वर्णन किया, मंत्र चिकित्सा, और आपने जो संगीत का भी दिया, बहुत ही अद्भुत रहा, प्रेरणादायक रहा है आपका व्याख्यान। अभिमन्यु को याद आती है। महाभारत काल में अभिमन्यु को भी संस्कार दिए गए थे, जिसने जो है चक्रव्यूह भेदन का ज्ञान प्राप्त किया था। बहुत बहुत अच्छा वर्णन किया भारती जी, बहुत बहुत बधाई राष्ट्रीय विद्यापीठ को और आपको। सुंदर चित्रण किया मंच आपने।
તો એક મોડું કરે ને તને ખબર નહોતી મોન જગાડે હા હવે તારા નાખી દેવાનો હોય
એમ નહીં ચડ્ડીમાં હાથ નહીં નાખો ઈ ચડ્ડી પીરી પહેરતી છે ડાયરેક્ટ પેડ વગરની તો બાજુ કઈ
કાયડું નહીં ખરું
કેવું માયરું મને
હા કાયડું નહીં
કેવી રીતે તમારે
Do we have any other questions?
કડી કડી કતી દીધું
I love you और मैं दिखा हमारा प्यारा सा दिखा
Shruti, please close your mic.
दादी का गोटा दादी को गोटा
Thank you, ma'am. On behalf of the organizing committee, I would like to thank Professor Bharati Kumarmangalam ma'am for delivering such insightful lecture. I would like to extend my sincere gratitude to our mentor, Vaidya Devendra Tribhunaji, President GB RAV, for his continuous support, guidance, and blessings. I thank our Dr. Vandana Siroha ma'am, who is guiding force for all the events at RAV. I would also like to thank Vaidya Rajesh Putlika ji, Secretary Ministry of Ayush, for his participation and encouragement in all our endeavors. Most importantly, I would like to express heartfelt thanks to all the gurus, shishyas, and other scholars who, with their presence and active contribution, make this webinar a successful one. Last but not the least, I thank each member of the RAV organizing team who worked behind the stage to make this event successful. Thank you.
Thank you, Ma. Thank you. Thank you, and namaste to all respected teachers.